When you hear of medical missions, typically you probably think about overseas missions or missions to third world countries, but it's happening right here in our own backyard. And Nancy Anness is the Chief Advocacy Officer with St. Thomas Health, who's going to talk about these missions that have been going on now for about a decade.
Yes, they have.
Appreciate you being here and the good work you're doing in Nashville for people who are either not insured or underinsured, correct?
Correct.
All right, so how did this get started?
So in 2008, myself and another director at St. Thomas Health was Amber Sims. We had done an executive spiritual formation at St. Thomas Health. We needed to have a project at the end, and I had coordinated several medical mission trips overseas and done a lot of work like that. And I said, you know, there's so many poor in our own backyard. And as a family nurse practitioner, I see it all the time. And so let's have a medical mission at home, right here in Nashville. And our first one was December 6, 2008. It was at the Holy Name Catholic Church. And we had 8 volunteers, and we saw over 100 patients in 2 hours.
Goodness. You said, you know, you can treat somebody under a shade tree.
That's right.
You don't have to go into a doctor's office if need be. If
Absolutely.
You can take care of them. What has the response been since that time? I would imagine it's grown and grown and grown as the awareness has grown, that
yes.
you're there.
Yes, it's really grown. We've done, this will be our 38th medical mission at home, which will be in Nashville at the Municipal Auditorium. And we welcome anyone who is uninsured or underinsured. Please come. We provide medical services. This is all free to the public. Medical services, dental services, vision care. We have free pharmaceuticals, as you know, they're written by the physicians or the nurse practitioners. We also have screening mammograms. We will have.
Oh, really?
Yes.
So you offer that extensive of a service, preventative health.
Yes, preventative health. We also have, in addition, foot care, foot washing, and we will have digital x-rays. We'll have chest, extremities, spine x-rays on site with real-time results, and we will have ultrasounds, abdominal ultrasounds, pelvic ultrasounds, thyroid ultrasounds, anything that patients might need. We will have that on site.
What happens then, Nancy, if you do diagnose something significant in the patient? Then what kind of follow-up care can you provide?
That's a great question. Before people leave, if they don't have a primary care provider, we make sure that they are discharged with a primary care provider and a follow-up appointment. If they already have a primary care provider, we make sure they have all of that documentation that we did for that day, where there be the full lab panel, CBC, CMP, hemoglobin A1C, you know, INRs, serum lipids, etc., things like that. We will make sure they have that to take back to their primary care provider and also to establish with a new primary care provider. If we find something that needs surgical intervention, which sometimes we do. We find, you know, large masses on thyroids or mass on ovaries, things like that. What we do is we make sure that they get in for follow-up, and we make sure they get in for follow-up usually at one of our St. Thomas medical partners, physicians, surgeons, who will follow up that patient, and it will be based on their household income sliding scale.
Is this something that St. Thomas sees as part of its mission? I would imagine so.
We
obviously.
do, yes. So our mission is rooted in the loving ministry of Jesus as healer. We commit ourselves to serving all persons with special attention to those who are poor and vulnerable. And we really believe that this is just part of, you know, really putting our words in action, providing these medical missions at home. Number 38 is so important because so many people are uninsured and underinsured.
Are you seeing a lot of elderly, more children? Who are the most vulnerable?
That's a very good question. I think we see, you know, really the people who are 18 to 64. Because when you're, you know, newborn to 18, you do have coverage, but, you know, through Cover Kids and TennCare. And then predominantly if you're 65 and older, Medicare is available. So it's really that age range between 18 and 64 that we see.
And you've seen the need increase, you said, because of changes with Medicaid. Is that correct?
Yes, we've seen the need just increase. Now we see where, 10 years ago we saw, 100, little over 100 patients, our very first medical mission. Now we're expecting anywhere between 900 to 1,000 patients on September 22nd at our medical mission in Nashville. So it's just grown exponentially. And we believe that one of those reasons is because we as a state in Tennessee, unfortunately, we did not expand Medicaid, so therefore we have over 300 Tennesseans who are uninsured.
You're doing this how often each year? Are you doing several of these missions each year?
We do 3 to 4 missions a year.
Is it hard to get enough people to staff them, to get the support at your end, the medical personnel?
You would think that,
you would think so.
But we do not have problems with volunteers. Many times we had one in Warren County July 28th, and we had over 300 volunteers. Already for this one in September 22nd, we have nearly 400 volunteers that have already signed up. So
that's incredible.
We have physicians, nurse practitioners, pharmacists, nurses, opticians. We have people from ophthalmologists. We have people from every field of
what dedication,
medicine.
What devotion and dedication.
Yes.
Boy, we're lucky to have you here. Thank you so much. And you saw the information on your screen earlier for more, medicalmissionsathome.org. And we'll be right back after this.